Welcome and thank you for joining us this evening. My name is Jill Lilly. I am the chapter coordinator for ACAP Central County. I invite you to go to www.acapcommunity to learn more about ACAP. We are an educational nonprofit, and we are able to bring you these presentations due to the generosity of our sponsors, which include Encompass Health, Cook Funeral Home, Steinbacher, Goodall, and Yurchak, and Juniper. So we have a few housekeeping items to go over. If you need a restroom, it's back there where the exit sign is. We do have pizza and water over in the pass-through. Please help yourself. And there is a resource table there right before you get to the pass-through that has some good information that you may want to take with you. Please feel free to pick up anything that you want. And now I have one other thing. The College of Nursing asked me to provide this information about the quality of life in persons who have had a stroke. This information is over on the resource table, and I believe that Encompass may also have a program for folks with that have had a stroke. Yes?
Commission certified stroke program.
So you've got options. Anyway, please feel free to take that if you would like. And with that, let me turn this over to Danielle Michael. She is the Director of Nutrition Services at Encompass Health.
Round of applause, right? Yeah, let's do it. Make everybody up. It's a little dark. Okay. So welcome everyone. Thank you for coming. It's so great to see so many people here this evening. There was Teddy Grahams. I didn't realize there was also going to be pizza. So you come to a nutrition and aging seminar and you're going to get fed. So just a little bit about myself. I realize I do not have a professional photo. That's probably not 10 years old. So I put my little dog up there. That is Sammy.
Uh-huh.
Yes. So I started at Encompass Health in April. So I'm pretty new to the position here, but have been in nutrition and dietetics since too many years. I don't even talk about it. I did my undergraduate at University of Delaware and did my master's at Penn State, which kind of had me arrive here in Center County early in my career. I was fortunate enough to do some sports nutrition work at Penn State University with the football team specifically. Really great and fun job, but then kind of wanted to move on to get my master's and worked in food service and nutrition, both in the sector of school food service, and then a little bit in the retirement area, and then found myself at Mount Nittany for about 12 years that I worked there as a dietitian and a guest services manager. And then I'm currently working, as Jill had said, as the Director of Nutrition Services at Encompass Health, which has been a blessing. Personal interest of me, just to kind of give a little bit more of a color to myself. I was a swimmer in college, so I love U.S. swimming, also love soccer, clearly love those long dogs called dachshunds, Penn State wrestler fan, and I also work as a YMCA instructor doing circuit training classes, and then also a youth director. So I hope you find this presentation interesting. I was going to go around and see what all of you wanted to kind of get out of it, but I think because of the mass amount, we might take up too much time, so we'll kind of wait to that area to questions if there's something that I possibly didn't answer in my presentation. So just as an introduction, nutrition at any age is a very important area of how our health is. Obviously, every day we need to sleep, we need to breathe, and we also need to eat. So I always kind of focus on those three areas, and nutrition is clearly my passion. So helping in those areas in any way, nutrition itself, you could do 100%, but even if you do a 10% change in what you're doing, it could really help improve what your life is moving forward. And just overall health-related quality of life, besides nutrition, there's a lot of other things that come into it. So even if you have a perfect diet, I have friends that will come to me and says, I don't understand, my dad is, works out, 5 times a week, eats a really healthy diet. There's other things that could possibly interfere with the health outcome. So just not as a disclaimer, but there's clearly medical and other health statuses that could interfere with that. Just some physical things, cognition, how you're working, your brain, a lot of, there's studies out there where Sudokus and word searches and just kind of keeping that mind active, especially as you're aging, is important. Environment is certainly an area that could impact your health if you have a perfect diet. Environment could also, gender, age, and then unfortunately that one thing that we have no control over is genetics. So a lot of things, whether it's your parents have diabetes or just how you've kind of been raised, they can really impact it. So just as something that kind of eases your mind that I'm trying to do everything I can, these are some areas that could possibly you couldn't have any control over. So what we're going to kind of go over today are some of the common concerns as people are aging. So when it comes to nutrition, obviously oral health and all of these areas, you think of the body as almost a machine. So when you buy a refrigerator, it's great the first 2 or 3 years that you have it, but as it continues to run and run and run, certain things could possibly break down on it. So that is where a lot of these areas are coming into play. So our oral health, our teeth are super healthy once our baby teeth come out and our adult teeth come in, but 70 years later, they may break down a little bit. So chewing and swallowing issues may become an issue. Decline in meal take, that could be a lot of the time from any kind of altered taste or decrease in appetite, whether it be they don't have that same environment of eating that they used to have, where they used to have a family meal, or they lost their significant other and they're only eating by themselves. That could assist to part of a decline in meal intake. Overall, when it comes to those medical issues, any kind of memory impairment or dementia could also decrease in any kind of nutritional status or what you're eating for every day. Lack of social support, isolation, depression. If there's not really transportation to go and have meals every day, or there's finances that could be an issue there, that could be a reason that you would have some decrease in nutrition. Chronic disease and medications, that's kind of where that whole machine, that refrigerator is great the first day you get it, but as you go age it out, it doesn't always have the best running machine. So you could have some chronic issues, whether it be your heart issues or some of your digestive organs aren't working the best. Those could decrease the nutritional content. Osteoporosis, which we'll definitely get into, and nutrients that can help assist with that. Lack of transportation, other resources, those would kind of be if you're not able to drive anymore, and then just impaired digestion and nutrition absorption as we age. So senior health overall, we face a number of challenges related to health and the well-being as we age. The percentage in Center County actually is not as bad as overall Pennsylvania and when you come to the entire United States, except when it comes to asthma and depression. We are really kind of a little bit under that radar when it comes to Medicare patients, but still just something to kind of bring up. So here's just a little chart here, and I highlighted the areas that we are higher in. Asthma, I didn't really do much research because truly it's not a nutritional related area, but depression, I've learned in the past couple of weeks that Pennsylvania and South Dakota kind of go back and forth when it comes to the amount of sunlight that we get per month. We're pretty much either 49th or 50th in that area, and a lot of that could or be the reason that we are in that percentage of clinically diagnosed depressed adults. 14% versus, the amount of adults is not a lot, but it's still higher than what the average is of Medicare patients overall in the United States and Pennsylvania. And then just to kind of ease your mind when it comes to other diagnosis, I thought this was an interesting table to kind of show about 52% of Medicare patients are diagnosed with high cholesterol. It's a pretty normal thing. Coronary heart disease, around 30%, a little under. Stroke, a little under 4%. So just to kind of pull some numbers and data into there gives you a little bit of idea of where we are here in Center County versus the rest of the state and also the United States. Any questions before I move on? Okay. So now we're just going to talk a little bit before we get into specific nutrients. So making sure as you are either children or yourself are understanding what your medications are. So making sure that you have a very good list. My dad has pretty much updated me every 3 months. He tells me what medications I have, and he has a copy of it in his freezer at home in a vault. And then he gives my sister and I a copy. And it's just very reassuring to me that I know what he is prescribed by his doctor, and then anything additional that he is taking that is over the counter, because if anything happens to him and or we need to go into an appointment, we make sure that we have that list with us, because there's a lot of different interactions that could possibly happen with the over-the-counter medications versus the prescribed medications. And there's some areas where medications can have some kind of drug nutrient interaction with it. The big one is warfarin or Coumadin. Is anybody here on that medication? It's a blood thinning medication. Okay. Well, that's one I just wanted to kind of bring up to, kind of trigger the mind, because there's some certain nutrients, and there is a state law requirement that if you are admitted to any kind of facility, either a dietitian or a pharmacist would come in and do that education with you to say, watch these certain foods so you don't have any interaction with the absorption of the medication. So now the fun part, my favorite, is going into some of the nutrients and then just some of the other psychological things that happen when it comes to food, aging, and our mental health. So the first one is calcium. Calcium is one of the most crucial nutrients that we want to make sure you get into your body, whether it's you're female or a male, and that's mainly to delay the process of osteoporosis. So osteoporosis is basically the brittling of the brain, or of the bones, and you want to make sure that you're getting enough calcium so that you continue to have your bone strength. It helps also the muscles to contract. So any kind of low levels of that will could possibly have bone loss, bone brittling, or broken bones. And it might not necessarily be like you're walking and you won't really feel that your bones are less strong, but it could be if you fall, which is one of the scariest things that I think all of us think of as we get older. If you fall, the kneecap could break, a hip could break, a leg could break. So making sure that you're getting those sources into your body every day. Recommended for women, it's around 1,200 milligrams per day. Men, it's 1,000 milligrams per day. And those foods what's that? The foods that you can find it in are obviously milk or any kind of dairy product, and dark leafy greens and canned fish. So milk itself is great, but a lot of people don't really enjoy drinking milk. Interesting, and I kind of in the same way, my sister was the same way growing up. So here's just a little bit of other areas that you can get the milk in. Would be some cheeses, about an ounce and a half of cheese, which is about the palm of your hand. Cottage cheese, about a cup to 2 cups of cheese. Cottage cheese would be good. It's just a little bit high in sodium. And then pudding is a really good one, but it would have to be a homemade pudding where you're making it with milk to get that calcium in. And then also any kind of calcium fortified, if you can't tolerate the milk, like actual dairy milk, having a soy milk would be another way that you could get the calcium in. And then the next one kind of goes in in with calcium, it's vitamin D. It also helps protect your bones and enhances that calcium absorption. So you can drink all of the calcium or have all the calcium that you want, but if you don't have that vitamin D to connect with it, it doesn't absorb as well as if you would not have the vitamin D. The best way to get vitamin D is what is outside right now, and that's beautiful sunshine. That is the best way to get your vitamin D. But other areas that you can get it would be in some fortified milks and cereals. I actually, before my class of today, I was checking. I'm like, I haven't checked my my dairy products at home to see how much truly is on that nutrition label, and it says 0. And it made me very upset because I realized, I buy just cottage cheese, but the milk is fortified typically with vitamin D. So that's one little area that you would want to pay attention to. Eggs, kind of the same way. And then there's some different fishes that tuna, sardines, salmon, mackerel, those are all kind of canned fishes that you would have. They would be higher in vitamin D. But like I said, the best way and the easiest way most likely is to get about 45 minutes of sunlight to really kind of increase your vitamin D. You can also supplement yourself with vitamin D. A lot of times when people are admitted to the hospital, they will supplement with vitamin D just to make sure that they're up there. Another reason, not only because my name is Danielle, but I am passionate about vitamin D is because it does help with depression. So the next slide here I have, and this is kind of a step away from nutrition, but also kind of plays into it. So depression and aging sometimes goes hand in hand because a lot of the reasons that people become depressed is because they're getting health problems that they don't have control over, or they have people that they've lost and it makes them upset and sad. And they have reasons why they can't do things that they used to be able to do. We recently had a patient in Encompass, and he was an avid tennis player. And luckily the US Open was on that he was able to watch the US Open, so he kind of fulfilled himself from there. But I could tell deep down that he was not able to really do that one thing that he really enjoyed doing, which was playing tennis. So in the effects of that, a lot of the time with depression, people aren't eating the same way that they should be eating. Either they eat everything because they just don't feel like they have control over what they're currently doing, so they just go and eat everything, or they don't eat it at all, or they eat kind of the same consistent thing because they know it's safe, but it's not necessarily overall a diet that would give you all of the nutrients that you need. I personally had that experience with my grandmother. She had she was diagnosed with diverticulitis, and so every lunch and dinner she had chicken, broccoli, a boost, and rice. And I could tell as 3 or 4 years down the road went, and this was before I was actually in school to understand it, she didn't have that same vitality that I knew was in her because she wasn't getting that variety of nutrients that she really needed to. And she had been seen by a clinical psychologist. They were working on certain things, and I wish if someone would have brought this information up to me, or I would have learned it, really early in my college career, I could have maybe intervened in that stuff. But just an area, a lot of the time, mental health is not something we want to talk about, but if you attack it a little early, it could help some of the other areas that have to do with your health. So we go into B vitamins. So we're done with the fat-soluble vitamins. Now we'll go into the water-soluble vitamins. These vitamins, you really can't get enough of. Your body will just kind of process them if you don't, if you have too much of them. B12 is the first one, and that's kind of needed for your red blood cell formation, DNA synthesis, and really that brain function is what it helps with. If you don't have enough of it, you can have some nerve issues, you can have anemia, and main areas you can find this in is fortified cereals. So those would be not necessarily your high sugar frosted flakes, although they do have them in it, but more kind of your corn flakes, your bran flakes, your raisin bran, those types of things. Recommended intake is about 2.5 micrograms. And if you really want to track that type of thing, I always suggest the best way to do it. If you can work with an app, that would be great. You can just kind of put it in as your intake and it will say that, or you can add it up on the nutrition label and it will give you that information. The next one is folic acid, which a lot of the time with nutrition, you hear that more with pregnant women, that it's an important nutrient, but it's also really important as you're aging, mainly because it affects that mood and that cognition, that brain function. It also helps protect from cancer and some heart disease. So trying to get some of those, and those you'll find in your favorites, which hopefully those are my favorites, but green leafy vegetables, fruits, dried beans, enriched grains. In this slide, we'll kind of just picture that a little bit. And again, looking for the nutrition labels, your fortified breads, you'll find it in there. Cereals, rice, any kind of leafy green will have that folate in them for folate. And then back to B12, you'll find that in some milks, yogurts, cheeses, eggs, and then certain fishes, again, like the tuna, the mackerel, sardines, the ones that are all kind of like the canned ones, but also easy to access. The next one, so fiber. So fiber is great for everybody. But of course, if your diet is not very high in fiber, you don't want to all of a sudden leave today and say, I'm going to get that 21 grams or those 30 grams of fiber, because your bowels will most likely not be happy with that. So you want to kind of gradually increase it. But fiber is super important. Not only does it help you feel full after a meal, but it also helps lower your cholesterol, which if you're familiar with cholesterol, it's kind of like if you think of a pipe in your bathroom and that gunk kind of fills up into that pipe. That is kind of what cholesterol is in our blood vessels. So fiber kind of helps break up that gunk in our blood vessels. Also helps with constipation and kind of keeping our blood sugars consistent. So it's, as I said before, it's recommended about 21 grams is the actual number, and 30 grams for men per day. But if you have more, that's okay, because the more would help the cholesterol aspect of things, help your constipation. So you're asking, where can I get that fiber? So it would be fruits and vegetables, mainly your fresh fruits and vegetables. If you're eating like a potato or an apple, you want to keep that skin on. That's where you really get the fiber from. Beans and lentils, whether it's fresh, I've never, ever personally been able to deal with the actual dried beans and soak them and make something from them. Every time I do it, I fail. So I feel like I'm in that generation that has to do the canned, but either one is very high. It is high in fiber. Whole grains, so those would be your brown breads, your brown rices. The browner the better, but just check to make sure. A lot of the time that some of those wheat breads that say they're wheat bread really just add a coloring to them. So you want to look at that nutrition label again to make sure that it's not 0, not 1, that it's at least 3 to 5 grams per serving. And then nuts and seeds. Diverticulitis, as I had shared, my nan was diagnosed with that. It is a common diagnosis, so that's something that you would just want to be kind of careful with if you do have any kind of diverticulitis. What I basically recommend is to just kind of track in your journal, say, okay, I ate some peanuts today and I was okay, but I ate corn today and I kind of got sick. So 10 years ago, they said don't do it ever. Now the recommendations are more, you could have it, but just kind of track to see if your body can tolerate that type of thing. Antioxidants. So these are natural things that are found in food. It's beta carotene, vitamin C, and vitamin E. And really what they're good for is overall helping your eyes, your skin, your teeth, and your immune system. So beta carotene, typically we say that's the orange food. So that would be your carrots, also your cantaloupe, your sweet potatoes, and then some other dark green vegetables. Those really help your eyes and your vision, even if you're wearing your glasses. And your vision seems to not be the greatest right now. It doesn't mean that you can't sustain where it's currently at. So Beta carotene is definitely one area that is a pretty easy snacky thing to kind of work with. Vitamin C, that's good for your skin and your teeth, sort of hydration aspects of things. You'll find those in your peppers, berries, tomatoes, any citrus fruit, pineapple, oranges. Grapefruit is a great one. And then vitamin E overall is really good for your immune system. So those are found more in your sesame, olive, and canola oil. So if you do cooking at home, those would be good choices to pick for your oils to cook with. Vitamin E is one thing that it's a fat soluble one, so that would be one that you don't want to have 1,000 servings of. You want to watch your servings of because it would also be high in calories. And as far as optimal vision, so the phytochemicals and all those things that we were talking about will help with cataracts, macular degeneration, any kind of diabetic retinopathy, dry eyes. If you have issues with dry eyes, working on any of these different nutrients will help that, and glaucoma. So, kind of just stepping away from nutrients, talking a little bit more about specific areas. So, immunity and inflammation, making sure that you try to work on your immune system overall. It can help protect a lot of common diseases that happen: flu, arthritis, some types of cancers. COVID is also another one. And then even if you still get diagnosed with that, keeping your immune system stronger can help you fight off those diseases quicker so your symptoms aren't as strong. The body is better equipped to heal itself if you have those stressors and those injuries that are properly nourished. So even when you are sick, they always say, feed a cold, starve a fever. And even to this day, that's kind of the truth. You do want to feed yourself. Make sure that you're keeping yourself strong if you have any kind of cold. If you have the flu, you need to listen to your body. If your body's not willing to digest things, it's okay for 2 days to kind of limit yourself, but you still want to make sure you're getting yourself hydrated. You're still having some crackers, some type of fiber and fruit in there. Making sure that you're trying to enhance your immunity. So that would really also kind of focus on your protein intake. So protein not only will help your bone your muscle mass, but it also helps strengthen your immune system. So areas you'll find protein would be your fish, your any kind of meat. Mainly lean meat is where you want to kind of focus to keep your body healthier. Eggs, beans, any kind of nuts and seeds. That's where you'll find your high protein areas. And as I said, that will also kind of keep that muscle wasting. As we age, it's hard to keep that physique 18-year-old body going anymore. So you want to try to continue to get at least 1 gram per kilogram, or basically 2 grams per body weight of protein in there. Trying to reduce inflammation in the body. Inflammation can happen when your immune system is being attacked by basically some kind of disease. So that could be fungal RA, rheumatoid arthritis, Crohn's disease, heart disease, any kind of diabetes, and even Alzheimer's disease. When this is going on, it can actually do more harm. So you want to try to reduce that inflammation. Ways to reduce it: eating healthy fats is the first way. So that would be trying to get cooking oils as olive, like we had talked about, olive oil, sunflower oil, and then introducing other foods like avocados, nuts, flaxseed, salmon is one of the biggest ways that you can do that. And then also some like nuts and berries, blueberries, strawberries are a great way to reduce that inflammation. Trying to increase at least 3 to 5 servings of vegetables and fruits per day would help that as well. And we will go into that near the end of this segment. Just want to kind of talk a little bit of hydration. So as we age, hydration is very important, because if we're not drinking, we could really decrease the way that our brain is working. So trying to make sure that you get at least 8 glasses of water a day. So that's about 64 ounces. More of that is even better. I kind of put on here this fun little thing. I always think that this is a great way to not only motivate people working, but also adults sometimes kind of watch the time tick away. This would be a great way to make sure that they're getting enough hydration that they need to. They can, just drink water, or there's also ways that you can make water fun by adding different citruses, fruits, lemon, lime, orange wedges, even, if they want to have a Crystal Light packet or something in there just to give them the flavor. Hydration is so important for so many reasons. So it's definitely important to get that at least 64 ounces. If you are close to your loved one, if you feel comfortable and they feel comfortable checking the color of their urine and making sure that it's not really, that golden yellow, trying to make sure that it's as clear and opaque as possible. There are certain medications that could possibly affect that, which a pharmacist, or if you look at the sheet from the pharmacy, they would tell you that information. But trying to, check the urine is definitely the best way to see how hydrated somebody is. But I would definitely say if you are having issues with hydration, to try to invest in a bottle like that, just to say, I'm getting there, I'm going to be drinking it, I need to drink 2 of these a day. It's kind of that goal setting mentality. Exercise. So exercise is one of the most beneficial things that you can do. We've talked a lot about foods that will help your body, but exercise will help your bone density, it will help your muscles, obviously. It will keep your mind going because you're, functionally working towards things. You're also interacting with other people and kind of working towards a goal. So they will help reduce arthritis, heart disease, diabetes, along with all of other overall disease states. And the recommended is about 30 minutes to 60 minutes a day. And it just moderate, intense workout. So even if you're taking a 10-minute walk 3 times a day is, really the recommended. You also want to try to incorporate any kind of weightlifting that will help with any muscle movements, flexibility, balance. We have I think we brought up a little bit earlier, the stroke class. We have a Tai Chi class coming September 24th, I think it is. So in a couple weeks that you can attend at Encompass Health. It's a very popular thing. Tai Chi seems really kind of scary even to me, but I think it's something that is really beneficial to just be exposed to see how this could help. Yoga is another way. Yoga is just kind of a fancy and trendy word for stretching that would definitely also kind of help with that as we age, getting that flexibility, balance, mind focus, not just necessarily on the ailments that we have, but working more on that inner self and where you can improve yourself, kind of connecting that body area. Last thing is meal prep. So there's a lot of different things you can find on the internet, on YouTube about meal prep. Again, this could be kind of a social thing to do on a Saturday or Sunday, or if you're working the weekend on Tuesday, that you can go to the grocery store, make a list prior to, see the different meals that you want to do, or maybe you just want to do 2 meals, and sort of, create the meal, buy containers that you can freeze stuff, because food is expensive nowadays. You don't find anything in the grocery store that's $1. So kind of trying to find things that you can make full meals of, follow that My Plate aspect of fruits, vegetables, grain, and protein. Create meals so that you know that you don't have to worry throughout the week about what you're going to be consuming, but have those meals planned. Making the grocery trip kind of a fun experience and not necessarily, like a dragging thing. It should be fun. You should try to look for new things that you would want to try to try, and then also looking for the seasoning aisle is my favorite thing. I am a foodie, but I like to kind of see they've done some really neat things, especially with everything bagel seasonings that you can buy that are actually salt-free. They have mesquite barbecue seasonings that you can do. If you like to go this Mexican route, you can find some Mexican ones. So finding not only those meats, proteins, vegetables that you want to do, but then finding some fun ways that you can season them. This is some government accessible resources, and I just if you're going to write down anything, I would ask you to write this website down here. So this one right up here. This should have taken me this, but it's not going to let me. But it gives you some really good resources about My Plate, which is what I was talking about. So if you take your plate, and this is recommended from ages 2 to 99. You look at what your plate looks like. You want grains, you want protein, you want your fruits and your vegetables. So that will give you a little bit more information, especially with older adults, about My Plate, how to read a nutrition label. And I'm happy to, stay after class if you have any questions about how to read nutrition labels. Resources about swallowing issues. So there's been, in the past 5 years, some new information and kind of clinical diagnosis of how we look at swallowing issues. So whether it be the extreme of a stroke or just in general, as we age, as I said, like that refrigerator, your muscles in your body are not as strong as what they used to. So as we age, you might find that esophagus is not allowing you to swallow rice, or every time I swallow a little bit of water, I get some coughing issues. This website will sort of give you some of those areas where you can not diagnose yourself, but see some information and then maybe see some other clinical areas where you could say, I might need some assistance with this, contact your doctor to see I am having some, issues swallowing, I'm coughing when I'm eating, because it does happen, and it's not fun to talk about, but it's definitely something that you want to address before you would aspirate. What that means is you would get food into your lungs, and then not good things happen after that. So, and then other areas that gives you just some exercises that you can do if you don't feel like joining the YMCA or coming to this beautiful facility to do classes that are scheduled here. So it gives you some resources of things you could do. Also, some other community resources. This isn't quite as updated. I had another PowerPoint that wasn't loading, so I apologize. There is some information that's not 100% accurate on here. Don't think the meals here are $1.50 anymore. They're $2 and $6.
I'm not sure.
I think so. It doesn't. Anyway, there are some areas where if you have some meal assistant needs, because either you're working or your family member is not interested in cooking, Meals on Wheels is a great go-to area. They do have meals right here. I believe it's Monday through Friday. Go to the website here. I looked at the menu, and actually I was scribbling down some ideas that we might serve in the cafeteria because the menu looks that good. The pricing is not accurate, so I apologize for that. And then there are some other areas, I believe it's in Penns Valley, that they serve some meals for outskirt towns, not necessarily center county, that have meal assistance. I will say another great thing, COVID was awful, but some things that came out of COVID were a lot of food assistance, like meal deliveries, or some other, like not necessarily farmers markets, but just like food pantry areas where you can kind of watch. I would say Facebook is the biggest one. That's kind of how I've learned from them. I go to church in Howard, and so I follow one in Howard, and they typically have one. I think it's about once or twice a month that you can find some just assistance in getting some food. Usually it's really great produce. Sometimes they'll have milks. A lot of the time they'll have some kind of protein in it that you can get some assistance with as well. Farmers markets, again, not necessarily free, but just something kind of fun and social in a way that you can get some nutrients at. And then the last one on here is just as an awareness, if you have any kind of issues with your insurance, there is the Center Volunteers in Medicine that would help with any kind of medical, dental, which insurance, sometimes dental insurance can be a little bit iffy, but you could go there and try to get some assistance as well.
They do.
Oh, that's
Yes. And I think they're almost done with that. Yeah. Yeah.
Through November.
Really?
I think I got something like that. Yeah, they're $5-10.
Nice.
Yeah.
Good.
They lasted at least the whole summer.
Great.
All right, so fitness programs. Center Moves is definitely an area that you can check out. Your local YMCA's, they do work with Silver Sneakers, which usually gives you a really reduced rate, if any at all. And then they also have classes that if you have that membership that you can attend. So it could be anything from super high intense circuit training to just senior stretch class. And you would be able to go to Bellefonte, Phillipsburg, Penns Valley, and State College. Transportation, Cataride, I know there's been a lot of things in the news recently about that, but it is still allowed or available for any kind of transportation. Social support, so there is a really cool program at Penn State. It's called OLLI. It's the Osher Lifelong Learning Institute, and it gives a ton of different courses and classes, and just to kind of, again, keep that mind going, anything that you would be interested in. They also have connections with the Master Gardeners Association if you have interest in any kind of like doing anything with flowers or gardening or anything like that. These are just my references of where I got a lot of information. But
That
yes, ma'am.
that last address, not this one, but the one before, if you just went to www.nutrition.gov,
This one.
yes. I'm sure you might have to take a few more steps, but I would think that you could get to what you're pointing out here.
Yeah, so this website right here would give you all these. I don't know if I can share. Can I share my PowerPoint with this? Because if I do that, then it would give all the information. So that they would have access to all the slides. Is that with the recording?
You could email it to me,
Okay.
and I could then send it out.
Yeah, that would be perfect. This will give all of this in much more detail than I could
Okay.
cover this
Yeah.
evening.
Yeah.
I tried to bring it up here, but it's not. It's, computers are great
When they work.
they don't work. So I will give that. There is kind of all of it, the scientific numbers and all of that kind of stuff is in that PowerPoint if you weren't able to. So I am ready to be drilled out with questions. Yes, ma'am.
I don't have a question. I just want to comment on the farmer's market. There's a free farmer's market here at the mall. It's actually down at the other end.
Today. Did I
It
not
was
see-
today. It starts in June and goes through September, so this will be the last month. But it's the second and fourth Tuesdays of the month from 4 to 6 p.m. Now there is a line, but once the line starts at 4 o'clock, it goes pretty fast. But sometimes the line has stretched half of more of the length of the mall. So you have to be, if you want to get in the front of the line like I do, you have to be willing to bring a chair and sit for about an hour and a half. Otherwise, you can go to the back of the line, you'll get through. They have a tremendous amount of fresh
It's at
vegetables.
the old Stokers, right?
It's down where the old CVS was.
Yeah,
Down
okay.
by Macy's. And basically, it'll be ending. Today was one, and then there'll be another one fourth Tuesday, and that'll be it for the year. But then they've been doing it for 3 years now.
Now, do you need to have any kind of approval, or you can
No,
just
it's no income guideline. It's
No
free.
income guidelines.
Free.
Just show up.
Yeah.
The only downside is, like she said, unfortunately, it's very popular. So you got Tuesday, you need to come to the back line, wait for 45 minutes, or come a little early.
right.
So, but it's really neat.
Yeah, they move you through. Well, it's a combination of the local farmers that have excess produce that they can't sell at the farmer's market, or that they just want to donate. And then there's also some being donated by the
By
like
the food
like the
bank.
potatoes, the food bank has leftovers or extras. So it's all fresh, very good. I'd say 70 to 80% of it's coming straight from the farm field that day. Like the corn, the cob, stuff like that. Like today I got peaches, pears, red beets, potatoes, head of cabbage, carrots, corn on the cob.
Wow.
And I know I'm missing some stuff, but and pumpkin. So yeah, you'll get a lot of stuff. And you can say okay, or you can also, like, sometimes when I get cabbages, they give me a small head, you know, 'cause there's only the two of us, things like that. Or you can decline. You know, I didn't get any tomatoes today because I have a garden of tomatoes, and then peppers, there's other stuff.
What's your name?
Jane.
Anybody else? Anyone have questions? Yes.
Where do you get the coupons again from the agency on aging?
Were they on the website or?
I
Here.
think that they have them there, but you have to fill out. Like, okay, you did it. Is that when you did it? I did it for my dad. I want to say I printed a form and then I sent it to Belmont. And then they sent it to him. They did that. I did it.
I maybe just call their office and see. That probably would be the best.
Yeah.
Which one? It's through Penn State. It is it's got a lot of awesome activities. So it's OLLI, and it's through Penn State. It's Osher Lifelong Learning Institute. Yeah, they've got, and they even do like trips sometimes. And yeah, they've got a lot of whatever your interest would be. I mean, it's not, unfortunately, it's not free, everything, but it's still a great resource. I don't see 55. Yeah, my husband's in there. Yeah. Anyone else have questions? Yeah, so that when I was talking about protein, that's one of the biggest things as you age. It's really difficult to keep that muscle integrity up, which is why protein is so important. So keeping at least a gram per kilogram, and obviously weight gain can also happen. But if you're eating a pretty overall healthy diet, a lot of the time, especially men, not as much women, but men, their metabolism, they really start muscle wasting. So that's why if you're not having a strong appetite, you're not interested in protein, a lot of people will go to a resource of like a glucose, or I'm sorry, Ensure, Glucerna, Boost, those types of things. I have to recommend them. I recommend them in the hospital because it's an acute aspect of things. But overall, unless you really feel like you can't eat food, it should be recommended for nutrients. But yeah, it is unfortunately, especially for men, something that happens. Women, our metabolism, as soon as we hit that menopause, and it just decides to like go on a roller coaster.
Is there a rule of thumb for how much weight loss is too much? You're not getting any.
I would definitely say so. There's it's not a great calculation for the average American, but I would say for adults it would be good looking at your BMI. If you get anywhere close to like a 19 or an 18 of your BMI, which would be your height over your weight height. The calculation is dropping in my head right now. But if you look it up easily and you put your height and your weight in there, if you get anywhere close to, I would say 19, I would definitely start being concerned that you're losing weight. And there could be other reasons, and I'm not trying to scare you, but there could be some other medical issues going on there. If you feel that you're eating to fullness and you're still losing weight, there could be some other reasons why you're losing weight. And obviously, if you're physically active, then you need to make sure that you're increasing the intake a little bit more. So if you're getting to that goal of physical activity and eating what you feel is full and normal, then I would definitely contact your doctor for that.
Just kind of a remedial question. I think I know the question, but I'm curious to hear a nutritionist standpoint. Obviously, you mentioned fluids out there. I think we all know and drink as many fluids. And obviously, water is the best. But kind of like everybody said, if water's not your favorite, obviously I realize that, Coke and beer and stuff like don't count really, so I understand that much. But, but I drink a lot of orange juice and things like that. I understand they have sugar in this. Is that sufficient? I mean, or do you really, obviously water is probably the best, right?
Correct. And I hate water, so I will be the first person to say that I'm not a huge. I can drink it after I work out, and after that, I'm kind of like. So what I try to do is the best way to get it is non-caloric beverage, non-caloric fluids. So if you're drinking like Crystal Light or not the diet soda is great, but anything that doesn't really have a lot of sugar in it, because anytime, whether you're diabetic or you're not diabetic, you add sugar into fluid, it makes it kind of gummy. It kind of gets that simple syrupy type of. So if you do like some kind of flavoring, I would try to find a way that you can flavor any kind of water, so that you're still getting that intake. Yeah, and another point, and I did bring this up. A lot of the time too, as we get older, incontinence can be an issue, but hydration is still important. Or you're on some kind of like pill, like a Lasix or something that makes you go to the bathroom a lot, but it's still, hydration is still important. So you can get it through food if you're not getting it, if you don't have those other issues, you can get it through foods that are high in water. So those would be like mushrooms and watermelon and anything that you feel is like really cucumbers that is kind of like a juicier type of item. It would be a way. We have a class with Parkinson's, and a lot of the time Parkinson's have issues with incontinence. So we say, if you can't drink water, we understand it's still important, but if you can get half of it through water and then half of it through foods that are higher in like a water content, it's important. I'm going to skip you because I feel like she's got a question over there.
Mine's kind of different subject. You were talking about the seafood in cans. If you're on a low salt diet, what would be substituted for that?
So fresh fish would be great, but a lot of canned seafood, unless it's like the sardines, the saltier items, like canned tuna typically if it's in water, it would be an okay food to get canned. So what really, as I said about learning that nutrition label and how to read that, if it's under about 200 milligrams of sodium, if it's canned, it's still okay. So fresh is your ultimate, but if canned, because it's way cheaper than canned tuna is much cheaper than fresh tuna. If it's under 200 milligrams, and if it's canned tuna in water in one of those pouches, it should be under that. So that is what I would suggest. It's a great question. But your sardines, your mackerel, you're not going to find those in that low sodium area. Does that answer your question? You sure? I know it's kind of a little bit of a brain answer. Yes.
I want to follow up with the briefing. How does tea and coffee fit in with the diuretic? Is that like I start every day with a pot of tea, which is basically 32 ounces of hydration, or what is it?
Take about 10% off of it. It's still, I mean, really, it's still hydration. It really is. But it's not pure water, kind of the same way. So there's still definitely water in there, but it's not 100% water. But it's still helping hydrate your body a little bit and not having anything.
Going back to the topic of Boost and Ensure, there's now a plethora of choices as far as the Boost Ensure side of things and all of the protein shakes, nutritional shakes. Can you talk a little bit about the differences there and what might be best to look for? If you go high protein, a lot of times that means that you're getting the artificial sweeteners in it as well. Is there a...
So the easy answer to that is Boost and Ensure is like Coke and Pepsi, basically. So each one of them has their versions of high protein, which I say is Mountain Dew. And then you have your Lucerna, which is like your Diet Coke. So those two are pretty comparable as far as what you're choosing. Some of them have different taste preferences. Some of them are a little bit lower in sugar than other ones. I really think that it would have to do, number one, with the medical reasons why you're taking them. So when there's a patient that comes into the hospital, for instance, we look at their full medical chart, and I look at what is their weight loss, what is some of their labs, what other diagnoses do they have? Do they have diabetes? Do they have dietary restrictions for other reasons why they can have certain things? So the easy answer to that would be I would just pick the middle average one, which would just be a boost or Ensure. Nothing high protein, nothing low in sugar. But if there's other areas on there that you would affect your loved one, then I would, and I can happily talk to you after this about those type of things. And really the reasons that we suggest those are, number one, if they don't have a great appetite, it's just sort of like a medicinal way to give them some extra nutrition so that everything else in their body is working. I know that there's some other, as you said, not only Booster Ensure, but there's like Premier Protein, and there's some other even like Fairlife. Like there's all of those. It's kind of a taste preference, and it's more what the macronutrients that they need. If it's calories or protein or carbohydrates, whatever they need that fits them best. It's kind of what would work best for them.
Where does the protein water fit into all that?
So the protein water would really just be that protein that's given you. It's not giving you not a lot of extra calories. It's just kind of making sure, as this gentleman back here had said, that as we age, our muscle wasting goes away. So protein helps us kind of keep that, as well as keep our immune system stronger. Question for her. I never did.
Is that protein water?
Yeah, we have.
Protein water
Is
great.
it flavored or is it?
Yeah, there's she gets it online for me, and there's
They have it at Walmart too.
yeah, and they have it at Walmart, but it's so much easier than just drinking plain water. And usually,
There you go.
yeah,
Protein water.
yeah, it must be fairly new, but it's great.
Yeah, I think I saw it with Propel has had some out. And it's so funny because a lot of these are really marketed towards athletes. But they're so great as we age too, which is kind of cool. So
Different type of protein too. You have the difference between soy and whey protein.
yeah, I mean that's getting super technical for sure.
So a lot of times in the water, it's whey protein, which is dissolved in the ether. You also have to worry about taking too much protein, or it will impact your creatinine levels.
Correct.
So the difference between normally I know the best thing to do is get it through the food basis eating, but what about supplements?
What kind of supplements?
Vitamin B, vitamin C, capsules.
That's where I would
calcium
kind of
capsules. I mean, you walk through any store, you got supplements for everything that you talked about.
well, and that's why I think I had the medication statement on there that if you're taking over-the-counter supplements, over-the-counter medications, you need to make sure that you're talking to your doctor about those type of things, or a registered dietitian individually to have them. There are water-soluble vitamins like vitamin C. You can, not that you want to take 100 capsules, but you can take a capsule a day and eat a normal diet, and your body's going to process that and basically pee out that vitamin that you're taking, and it's not going to do much damage. But there are vitamins and minerals that could build up in your system. So before you take any kind of supplement, I would definitely suggest talking to your doctor about it. So yeah, that's a good question, and especially even taking like protein powder or anything like that.
You can easily exceed what you need for by taking the supplements.
You could, yes, but usually in adults, aging adults, it's not that big of a thing. But you could if you kind of get like a little bit. I didn't hear anything from you said all that much.
Anybody else?
I just wanted to make one more point. Olive oil is one of the most nutritional, wonderful oils to take in, but you should not cook with it. Over 200 degrees, it turns into a trans fat. And all the chefs lately are jumping on it because it's so healthy, and it's the worst thing you can cook with. Now, if it's a less refined olive oil in your canola oil in a blended oil mix, then okay. But pure, really good olive oil, you should never cook with it higher than 200 degrees.
And typically, when you're cooking sauteing, it will get over 200.
Well, actually, you should not saute or cook with it. It's not a healthy fat then. If you want to have it in your food, cook your food with something and pour it on the hot food on your plate. Don't cook with it. It's bad to do. And they're not teaching. I mean, they used to teach a long time ago. And now all the modern chefs are using it in their frying and sauteing. And frying and sauteing, you're over 200 degrees. You can't fry or saute in your pan without being 200 degrees.
I mean, really, your meat only gets to about
The meat might, but the actual oil touching the pan, you're making a trans fat.
Any other questions? Yeah.
Do nutritionists check the vitamin levels before you start?
I'm sorry?
Do nutritionists check vitamin levels?
If you would have like a dietitian consult, like an individual, like if you and I would meet, I would make sure that I would get any kind of like labs done before we would do any interventions or anything like that.
No other questions?
Jill, what do you got?
I'm giving you a hand.
Thank you
I
all.
appreciate everybody coming. This is fun.
I'm going to shut this off. Sorry.